Hi, Assalamualaikum. My name is Siti Nobalkis binti Abdul Rahim and I will present about Mercy. Malaysia Medical Relief Society, or known as Mercy, is a non-profit organisation that provides medical help, health development, disaster reduction to communities, either in crisis or non-crisis situation. Mercy totally active in Malaysia and abroad. They already registered under the Society Act 1966 in Malaysia and their headquarters located on Kuala Lumpur. Mercy was founded by Dr. Jamila Mahmud in 1999, which is in response to the conflict in Kosovo. Mercy Malaysia totally focused on medical and humanitarian assistance, psychology, health-related sustainable development, and program water sanitation and hygiene, which is WASH. Mercy Malaysia collaborate with medical fraternities, education institution, private and corporate agency, government bodies, NGO, local NGO, and the community which is Mercy Malaysia work.
My name is Anis Ashiki binti Karudin. I will explain about activities Mercy in Malaysia. One of the activity that Mercy Malaysia has done in Malaysia is in 2019, Mercy Malaysia has initiated the project emergency response on chemical spill at the Kim Kim River in Pasir Gudang. It caused almost 500 people to be hospitalized, 10 people in ICU for upper respiratory tract infection. Mercy Malaysia worked hand in hand from 12 until 20 March to treat patients who come in with symptoms when the National Crisis Preparedness and Response Centre CPRC opened the Pasir Gudang Stadium as the trigger focus point. Mercy Malaysia also provide medical support for patients affected by the toxic fume from the chemical spill. Mercy Malaysia also made a seminar on mental health and psychology support MHPSS for 200 educators and school principal.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Nurin Farisa binti Muhammad Fikri. In this slide, I will present activities that performed by Mercy Malaysia at the international level. In early 2004, Mercy Malaysia continued to work in conflict zones and launched a fundraising campaign in collaboration with the Malaysian Ministry of Education to provide school bags for children in war-torn countries such as Palestine and Iraq. Mercy Malaysia has allocated 1 million ringgit Malaysia for Iraq in medical and humanitarian aid. Next, every year, a huge number of Cambodian children die because of dehydration, which is caused by diarrhea. Therefore, Mercy Malaysia conducted the Oral Rehydration Therapy Corner project and the employment of 2 outpatient department service assistants at the Angkor Hospital for Children.
Building resilient communities. Resilient in the capacity of a framework, local area or society presented to dangerous to oppose, retain, oblige to and recuperate from the impact of a risk in an ideal and effective way. Usually, this project will do on the area that have disaster that give impact to general public. What happen if we didn't pay attention on improving resilience? It can lead economy and ecosystem to drop and loss of trust by the population and investor. Frequent disaster can severely dispute community lifeline, such as a system that provides food distribution, water supply, healthcare, transportation, water waste disposal, and communication. For example, of the disaster is earthquake, tsunami, pandemic, eruption, flood, and many more. So there are few BRC program, which is community-based disaster risk, or known as the CBDRM. Next, a school preparedness program, which is SPP, resilient health infrastructure, which is RHI, private sector and local government. Local government is really important in order to encourage efficient implementation of the PRC program. It's really important.
Assalamualaikum and hi, my name is Nur Intasha Fiza binti Kamal. So today I will explain about the activities of Mercy, which is training. The volunteer induction program. It is a preparation program planned explicitly for recently enlisted volunteers where they are given complete information on Mercy Malaysia and its tasks. Next, the emergency medical team field training exercise. They get ready volunteers for Mercy Malaysia's clinical and compassionate help missions to war zones, regardless of whether in emergency or non-emergency circumstance. Third, the social first aid. As a clinical help association, Mercy Malaysia regularly sends for-fund help laborers to give well-being or other philanthropic guide to individuals influenced by emergency. Last but not least, the basic life support (BLS) training. The basic life support preparing is a drive by Mercy to give essential life-saving abilities to volunteers. Thank you.
And now, this slide will show you achievement of Mercy Malaysia. First achievement is Mercy Malaysia have received a Humanitarian Accountability Partnership certification. In 2007, Mercy Malaysia became the third NGO in the world to get this certification. Second achievement is the founder Mercy Malaysia, which is Dr. Jamila Mahmud, is the winner of the ASEAN Prize 2019 in recognition of her role in humanitarian missions and disaster management in the region. Last achievement is Mercy Malaysia won special mention in the SCCA Malaysia Environmental and Social Reporting Awards.
First recommendation is find a more sponsor from a big company to help people. Mercy Malaysia can find sponsor of money from a big company such as Senderby. The sponsor can make the work be more faster and easier to help people. This sponsor can be in the form of money that can make Mercy Malaysia easier to buy necessities, build the shelter, buy a pillow and blanket for people affected by the disaster. Next, Mercy Malaysia can collaboration with big company like EconSafe to get a basic thing for human being. EconSafe is a big supermarket in Malaysia that provide everything needed for people, such as groceries, household items, food, fresh produce, clothing, electrical appliance, hardware and plastic products. Lastly, Mercy Malaysia can be a teamwork with local and private hospitals to obtain supplies of medicine, medical aid and psychology aid for the victim. With this teamwork, Mercy Malaysia can make sure the source of medicine and anything that important for the treatment of patient is enough.
Make a donation among society. Mercy is a non-profit organization, and their aim is to help people around the world without getting paid. So their volunteer is a group of people that help people without getting any salary. Mercy must make more donation among society, especially the victim of natural disaster on rural area. Donations are not just in the form of money, but there are various forms of donation such as food, medical, psychology and clothing. They also can help the victim to repair the damage, help the victim clean the home if the natural disaster is a flood, and also provide their temporary shelter. And also we can see right now in Malaysia, which is pandemic COVID-19 getting worse day by day. So hospital totally overload, then they cannot give any treatment to the patient. So Mercy can provide assistance such as health and medical equipment. Other than that, they also can provide psychology assistance to doctors who are tired of working. Of course, after almost 2 years they work without getting any holiday, they are mental and physical totally exhausted, and Mercy can help them by that.
third recommendation for Mercy Malaysia is conduct volunteer activities at educational institutions and encourage their involvement. Students are strongly encouraged to participate in volunteer activities like Mercy Malaysia since it gives numerous benefits. And students can hone their initiative gift by participating in Mercy Malaysia. At the point when these teenagers get involved, they can train themselves to speak with others and can build their self-confidence. Other than that, students also can avoid being stuck with negative side effects. As we can see in this era, many teenagers right now are involved with negative side effects like vandalism. Unhealthy activities like this can dissolve the moral and respectability of teenagers. Ultimately, volunteer activities like Mercy Malaysia is very important not only in Malaysia but around the world.
Promote the role of Mercy Malaysia on social media. They can promote on platforms such as Instagram, Facebook, YouTube, Google and TikTok. But for now, I saw that Mercy only promote their organization on Google and Facebook. So, Mercy Malaysia should use the platform that more popular and more famous among generation, which is Twitter, Instagram and TikTok. This will make young generation know more about Mercy, so Mercy can promote their vision, mission, their founder, which country that they already help, and all the activity that Mercy do. So when they promote on social media, it will give a lot of advantages, such as they can attract interest of people to donate money and energy. They also can increase the number of existing volunteers, and they can also know which country that Mercy already help. If Mercy did not promote their activity on social media, people will not know about this organization. And the worst thing is they didn't know that this organization is actually exist. So it's really difficult to find any investor or donor. Not only that, the young generation also think that this organization is not worth to join.
In this slide, I will explain about the conclusion. Mercy Malaysia is a global non-benefit association zeroing in on giving clinical elevation, maintainable well-being related turn-off events and hazard decrease exercises for weak networks in both emergency and non-emergency circumstances. Mercy Malaysia has encouraged many people to participate in volunteer programs in our country. Mercy Malaysia has opened people's mind about the importance of helping people in need in our country. Thank you.